Today we're talking about Adelo, a platform that helps health organizations use hyperlocal data and AI to better understand and engage real communities. I'm joined by Mateo Munoz, Chief Operating Officer at Adelo, and Nicole Whitaker, Head of Accounts, to dig into how local insight is changing the way health decisions get made. Mateo and Nikki, thank you so much for being here.
Thank you for having us.
I want to start with this question to you, Mateo. At a high level, what problem does Adelo exist to solve?
So Adelo solves, I would say, several different problems. We really look to help pharmaceutical and medical device companies identify who they should be working with from study all the way through who they should be delivering to. And so we can help to identify at a hyperlocal level as we dig into the 8.5 billion data points that we have that are out there and look and see, okay, maybe you should focus your study in this region of the United States or in this region of the United Kingdom or whatever country that might be. So we can really dig in a lot deeper than we used to be able to, especially with the advent of AI and how quickly it is moving now.
So right now, it sounds like everyone is using AI in health. What actually changes when you go hyperlocal and you're able to really fine-tune those data points?
Yeah, so you're able to realize quite a bit of cost savings, I would say, right? Because in the past, as much as there was data out there, and speaking with a lot of other health officials, that's one of the big things that's been happening for us in the health community. There's a lot of aggregation of data that used to be disparate and out there to where we couldn't really leverage all that, right? So when I'm talking to researchers that I've spoken with, it's the fact that you can pull in all the information that you had on thousands of different PDFs, right? And put it into one pattern and then look at it from a truly holistic viewpoint and really data map everything. So one of the big things that we're working on right now that's in concept and we're getting closer to delivering is geomapping, to where you can take all those data points and then really zoom and hyper focus in on that hyper local level and go, okay, this community would be good for testing this, or hey, this community really has this problem. Maybe we should look at doing a study around this and how we solve that. So as much as we want to be on a large scale, right, solving the largest problems, we can now look at like those specific immunotherapy, those solutions out there, right? Those different items that we want to pull forward with our partners in these different medical communication companies and pharmaceutical companies and medical devices companies, like I've noted, and really help them to deliver better product and make it more accessible.
And Nikki, as someone who is head of accounts, do you have an example of a company that has been using your product to be able to target specific audiences?
Yeah, absolutely. So, I mean, as Mateo mentioned, getting on the hyperlocal level in one area where we have worked for years with different clients is within kind of drug studies and investigator meetings. And one thing that's so important in there is finding the locations where you need to recruit these kind of different groups of physicians to actually recruit for your study. And if we can look at a hyperlocal level of this is a location where this population is really prominent, and this is a hospital system who sees a ton of people with this disease state, then they can really focus those recruiting efforts in those areas in order to maximize kind of their return on investment as far as those recruiting efforts go.
So, Mateo, it seems to me that hospitals would really want this information because it would be critical to their survival.
Yeah, I'm going to go ahead and take that on like a broader level, and then I'll go ahead and pass it over to Nicole because she works with them on a more daily basis than I do. So on a larger level, there's a couple different pieces. One, it'll help with the drug studies and how to identify some of that stuff, but I'll let Nikki handle that portion. On a larger level, though, these social determinants of health that I haven't really talked a lot about, but are very, very important as we look at what different genetics people have and everything else, and we get more sophisticated, and as our colleagues can map these things out a bit further and we can identify these things, we can then look to prepare hospitals better. So you might want to look for this type of cancer or this type of heart condition. So in the past, doctors typically, and there's a few different studies out around this, they typically start to diagnose and prescribe based around their colleagues, right? So it's not really about where they went to school or what conferences they're attending. It's who they work with on a daily basis. As we all know, we're humans, right? So we absorb on more of that. But as we can look at their geographic regions, we can now look to go like, okay, these are types of treatments we should have hospitals ready for. So especially as hospitals, we all can say it. I'll just say it. Funding isn't the best for all of them all around, right? We have some different hospitals, especially in rural areas, that are being cut. So as we need to get a little bit more precise around these things, this is going to be very, very helpful. So we can go into somewhere in rural Utah and say, hey, this area, it is prone to diabetes. Just using that example, you guys should definitely have this type of equipment on site to be able to help with these types of outcomes, so we can have those positive outcomes. But on the study side and how we kind of advance medicine around the hospital systems, again, I'll pass it over to Nicole to talk a little bit more about that.
Yeah, absolutely, Matteo. So not only do these hospital systems want to participate in these studies because it can affect the level of grants that they're receiving, not only from the government, but also from the drug companies themselves, but it also solidifies their position in the as a location of expertise, and it can help them to attract these patients into their hospital systems, which obviously affects the bottom line.
Matteo, you mentioned earlier the massive amount of data that you are pulling from. And I know it seems like whenever we have a conversation about AI, part of it is trust. So how do you keep the insights useful, and how do you draw the line so that they don't mislead or break trust?
I will be very candid. This is not just for us, but with a lot of people right now, human in the loop. Keeping a human in the loop as we progress, right? So AI is helping us in advance in such an amazing way right now. But as we all know, there's slop that is coming out and everything else. Also choosing the right models. So Gemini having their healthcare model, Claude having their healthcare model. So as we build out, we recently switched over to Claude to concept. And as we vibe code different concepts out and we're looking to bring our technology forward, we're trying to go, this is the best AI model to work with, right? A lot of us are switching on a consistent basis right now as we look to find these, but we are keeping a human in the loop to make sure all of our data sources are proper, where we're pulling for, and we're creating the right frameworks. A lot of people are talking about the frameworks. I talk about it often. So much of it is in the framework. Like creating the right guardrails to make sure that we are putting the appropriate data forward and not letting bad data slip into there. So I think at some point down the road, it probably will move mostly to AI. But Nikki talks about this a lot within our company of making sure that we're really keeping that human element, because as we want to leverage AI tools, people still want to work with people. They still want to interact. They still want to make sure that we are keeping those guardrails in place, and especially in healthcare. As they're allowing access more, I understand why it's certain areas. So Nikki can talk to it again way better than I, but I've been on a few calls with her recently, and that's a huge question right off the bat. Do we have to use the AI that you are implementing? And the answer is always no from her, but it is pretty interesting to see.
Utah is a big proponent of putting people first and allowing AI to augment or supplement their jobs. And I'm wondering how that works into Adelo, where you have such a focus and emphasis on people.
Absolutely. So I can take this one. As far as our business goes, we are very true to who we are. And we have always been a service, a higher level service than our clients have expected from some of the larger companies that we are competing against in the industry. Because we are smaller and scrappier, we really focus on that human connection with our clients and with our colleagues. We're using technology to augment and improve and help to alleviate some of the repetitive tasks, but we do not allow it to replace us as humans. We are focusing on being creative and helping our clients find the best solutions for their problems, whether that's looking for a specific piece of data or engaging a certain audience in a higher level, and then interpreting the data that we're receiving back. So that's very much kind of our focus is we want to deliver a higher level of service, and we're allowing technology to alleviate some of the repetitive tasks and letting us focus on really delivering that.
Thanks for sharing that, Nikki. And along with that, when organizations come to you, how ready are they for AI? And how does Adelo's focus on real people and not just those clinical moments help them get there?
Yeah, so this is a great question. Obviously, within the healthcare space, there is some concern about utilizing AI for everything and whether or not they're able to remain compliant. And one thing that we always allow for our clients is if they are not ready for it, we will never force it on them. We are implementing AI in a way where we can ring fence it. So those clients that aren't necessarily ready to allow AI to interpret their data, we are not forcing them into that. We are still allowing them to work with humans until they are really ready to do that.
Mateo Munoz, CEO, and Nicole Whitaker, Head of Accounts for Adelo, thank you both so much for being here. I appreciate your time. You can learn more about Adelo at adelo.co.